We're talking about some imaginary lines on the thoracic area. Note that we are not going down to the abdomen, right? We'll just stay at the thoracic area. I'll talk about the imaginary lines at the thoracic area, the use of these lines, and why we study these lines. So we said that what many imaginary lines facilitate anatomical descriptions, identification of thoracic areas, and also location of lesions. So elaborate them. So if they say lines, imaginary lines, okay, that are on the surface, this is different from lines of pleural reflection. I brought this here because some students might confuse this for pleural reflection, but it is not pleural reflection. Okay, these are lines that are imaginary. They could be drawn on the body like this, just to help you describe structures. All right, now let me say if I want to describe the sternum now, I'll say that the sternum is midline. Okay, so midline, all these lines, like, they help us describe structures, okay, on the body, okay, related to the thoracic area. So let's have the lines now. We say that imaginary lines are used in anatomy to facilitate descriptions, identifications, and what locations of structures and lesions, right? So talking about examples of these lines, the one in the middle is obviously the midline, or you could say mid sagittal. All right, midline or mid sagittal. So talking about the midline or mid sagittal, you see that this one divides the body into the left and right halves. So if I drawing a line here, that means what? It is dividing the body into right side and the left side. Okay. Then we have the midclavicular line. Midclavicular line is like the clavicle bone is here. So as the clavicular bone is here, the line passing in the middle of this clavicular bone is a midclavicular line, right? So this one passes through the center of the clavicle and is used to locate what structures like the heart and lungs. Okay. Then we have the anterior axillary line. That's where you are going to the side now. So this is the axilla. So the line passing in front of the axilla is anterior axillary line. The one in the middle is mid axillary. The one at the back is posterior axillary. Okay. So for the one in the front is anterior axillary line. This one passes through the anterior axillary fold. This is the anterior axillary fold. This fold of skin that is usually here. Okay. So as it passes there now, it is used to locate structures like the lungs and pleura. Then for the posterior axillary line is here. Posterior axillary line, that one is at the back, right? So the posterior axillary line, it passes through what? The posterior axillary fold, and it's used to locate structures like the scapular and latissimus dorsi muscle. Then we have the scapular lines. These are the lines that if it's at the back, okay, I didn't have any, but you know where the scapula is located, right? So some lines could be drawn on the scapula and all those stuff, okay? So scapular lines passes through the inferior angle of the scapula and are used to what? Locate structures like what? Lungs and diaphragm, okay? Then we have the transpyloric line. This is a transpyloric. This one passing here. Transpyloric, where if you know the digestive system, the pylorus is where the stomach is joining to the small intestine. So the junction where the stomach joins to the small intestine is where this line passes at. Okay, so the junction there is where the line passes at. So it passes through the pylorus of the stomach, used to locate structures like duodenum and pancreas. Okay, so these imaginary lines will help you to describe anatomical locations and relations. They help you to identify thoracic areas and regions. They help you to locate lesions, tumors, and injuries. Okay, describe. Like, help you to describe something. Okay, you say that what? This lesion is above the transpyloric line. You see that this lesion is what? In front of the anterior axillary line. So to just help you to describe these things in the thoracic area. All right, so these are the imaginary lines that facilitate anatomical descriptions, identifications, and also locations of lesions in the thoracic area.